G'day everyone. Today we're talking acute medical management of aortic dissection. You've diagnosed a type A, the cardiac theatre is being prepped, but the patient's systolic blood pressure is 190 and they're tachycardic to 110. We need to change those vital signs, and the reason is because of aortic wall shear stress. We are now focused on minimising aortic wall shear stress so we can minimise progression of the dissection. We'll achieve this firstly by controlling pain. Generous doses of fentanyl or morphine will be required. Then we'll start anti-impulse therapy to get to a heart rate of 60 beats per minute first, and then a systolic blood pressure of 100 to 120 millimeters of mercury. There are two components to anti-impulse therapy, the first of which is reducing the velocity of LV contraction and, in turn, the heart rate. IV beta blockers are the agents of choice here. Esmolol is a cardioselective beta blocker with a very short half-life. This is useful if that type A dissection becomes complicated by cardiac tamponade. A bolus is given first, 250 to 500 mics per kilo, followed by an infusion of 25 to 50 mics per kilo per minute. An alternative is labetalol. Labetalol is a beta blocker that also has some alpha blocking action. It is given as a 20 milligram IV bolus to start. Repeat boluses of 20 to 80 milligrams can be given every 10 minutes, up to a total dose of 300 milligrams. Next, we turn our attention to the systolic blood pressure. The beta blocker will have taken us some of the way to our target, but if we need to go a bit further, we add on a vasodilator. UpToDate favours nitroprusside, and because this is not a commonly used drug in our ED, it's best to look up the dosing protocol at the time. GTN is an alternative, and a specific point is made by UpToDate to avoid hydralazine, as it provides less accurate and reversible control of the blood pressure. It's important to stress that vasodilation should not take place before heart rate control with beta blockers has been achieved. This is due to reflex activation of the sympathetic nervous system that could take place with pure vasodilator use that would lead to an increase in aortic wall shear stress. So that's the acute medical management of aortic dissection in a nutshell. Thanks for watching.